It said this video is private.
It's now streaming live. I think we're live. Oh, I see a little setting there. Yeah, it should go to public, but hmm.
Working now. Don't worry.
Oh, is it? Okay. Okay. All right.
So let's wait for a minute or two and then we can start, right? Yep.
Perfect. Okay. Let's see. Okay. Should we get started?
Yeah, sure.
Wonderful. Thank you so much, everyone, for joining us for our second lunch break webinar. Hope you're having a good day so far. We'll get straight into it. We've got some really interesting discussions to have today. If you weren't here last month, a very quick introduction. My name is Rebecca, and I'm a patient support officer with Hashir International. I work with others who are affected by misophonia or going through our treatment programs. I have misophonia myself. And I am joined by Mercedes Afanian. She is one of the most active researchers in the field of misophonia and one of the few people who brings their work and experience as a neuroscientist to that research. It's great to have this conversation with her. Her knowledge is so valuable. When scientists wanted to create the very definition of what misophonia is, Mercedes was on that panel of 15 global experts who contributed to the description that we use today. And our subject for today, we're going to explore something that happens immediately after someone with misophonia hears a sound that is a trigger for them. So how much do we know about that immediate reaction? Is it a response we can control? Is it a reflex? Before I begin sharing my perspective on this, I want to mention that I'm going to be using those three terms, reaction, reflex, response. I'm going to be using them interchangeably while I describe my personal experience as a non-expert. However, there are important differences between them, and that's something that Mercedes will be explaining scientifically afterwards. So to start at the beginning with the cause, we talk about the most common trigger sounds in three categories. We talk about human mouth sounds like chewing, breathing, coughing, other human sounds like tapping or knuckle cracking. And then we can talk about environmental sounds such as construction, vehicle noise, music. It's very easy, maybe as an outsider, to see all of these sounds in the same way, but obviously there's lots of differences based on that person's experience with their own misophonia. And from talking to patients about their experience, I've heard lots of variations on what can be a trigger. But let's use a common one as an example, which would be chewing sounds when someone's eating. In a situation like that, when you're sitting at the table and you hear the sound of someone else chewing, that noise, it can feel like it immediately causes the brain, the body to react. And the word immediately is a really important one here. From my own experience and how patients have described it to me, it certainly feels like there is little to no time between the sound and a reaction happening in our bodies. Hearing that chewing sound, it causes might be the head turned towards that noise. It could be clenching your fists, clenching the jaw. It can be verbal, like a shout or a sigh or an outburst of anger. Some of that might be very relatable to people who are affected by misophonia, and there could be many other responses that we do when we hear those sounds. But the important part, and what we're discussing today, is the fact that from personal experience, when that happens, it can feel like it is completely unavoidable, an unstoppable thing. Patients I've spoken to describe it as almost being unaware that they're having this reaction. There's no conscious decision-making process. It's lightning fast, and before you know it, the sound has happened, and you've snapped verbally at the person or tensed up or reacted in some way. I think it's fair to say that to people without an understanding of misophonia, those reactions can seem inappropriate or impatient or kind of overblown. And others might think, oh, it's easy, just ignore the sound, or it's not that loud, or you should be able to hear it and not cause a scene. And it's very easy to say that, but it's a really complex conversation. From my own experience, when a trigger sound was made, I would often physically turn my head in that direction. And it felt like I almost couldn't control doing this. It was automatic, and it felt like it happened before there were any thought processes that came into my head. And I hear this from patients as well. Just one part of our CBT-based treatment is gaining awareness of the thoughts that follow a sound. And when I speak to patients and ask them, oh, how is that going? Is it a challenge? How is that happening? They say it can be really difficult, and it's a really important part of the step, but it's really, really hard to kind of notice the thoughts before we're already angry or we've already reacted. It feels almost impossible to kind of press pause in that moment. And so this kind of brings up a very interesting idea. Are these misophonia sound reactions similar to perhaps other reflexes that everyone can relate to, whether you have misophonia or not? So, for example, when someone else yawns, we often yawn too. It's kind of this mystery to people that don't understand the science of it, but even talking about yawning can almost cause that reflex to happen. We don't consciously make that decision. Or another simple example would be when something flies close to your eyes, you blink. I would say that was a reflex. And if someone asked you not to blink when that happened, or not to yawn when someone else yawned, would you be able to? Or, would you be able to interrupt that reflex? Or would you say, oh, I can't help it though, but it's my body making me yawn or blink, it's automatic. So can we take that understanding and apply it to the reaction that someone with misophonia has to a noise? What if we look at reactions to trigger sounds in the same way as other reflexes? Should there be more patience or consideration giving if they're similar? Can this maybe even help bridge the gap of understanding of how it feels to have misophonia and provide an example that anyone else can relate to? So that's throwing a lot of questions out there and a lot of personal experience. So on that note, I'm going to hand over to Mercedes, who can really help us to explore this from a scientific perspective, and then we'll have some time for questions at the end.
Okay, cool. Thank you very much for the introductory introductory you just gave. Actually, my talk is going to be very, very much like the way that you categorize all these reflexes, reactions, and responses. But before that, I would like to say hi to everyone, people that are watching us, and I'd like to take this opportunity to inform you that these webinar series are organized on a monthly basis. Again, we encourage you to stay connected for upcoming sessions, and these webinars are brought to you by Hashir International Institute. Towards the end, as Rebecca also mentioned, we will allocate a few minutes for a Q&A. Do you think that it's worth going back to the definition of misophonia again? And this is very important since still we see a lot of people, sufferers, and also researchers that really do not stick to this very definition. So I would like to, kickstart the webinar / talk with stating the latest definition of misophonia. According to the definition that you also mentioned, the consensus paper that came out last year, misophonia is characterized as a disorder marked by reduced tolerance to specific sounds or stimuli associated with such sounds. So again, like what Rebecca mentioned, when a person with misophonia hears or sees triggers like chewing, they may experience pressure in the chest, arms, head, or entire body, as well as a clenched jaw, teeth, or tightening of their muscles. Additionally, they may sweat or feel an increased heart rate, body temperature, or blood pressure. These bodily experiences are akin to those felt when we are in anger or anxiety-provoking or scary situations. So we really do not have any control over them, and I will explain why. And after being exposed to misophonic triggers, individuals may experience anger, irritation, disgust, anxiety, or even rage towards the source of the sounds, which can be another person. The reaction is typically stronger if the triggers are caused by a family member, and most individuals with misophonia do not seem to react as strongly if the triggers are generated by a stranger or self-generated. So, but before discussing why individuals with misophonia experience these symptoms, I need to explain what is the exact difference between reflex, reaction, and response. And I would give more or less the same definition as Rebecca. So a reflex, what we mean by reflex is basically a type of behavioral response that is very unconscious. So let me put it this way. A reflex is involuntary and nearly instantaneous movement or response to a stimulus. It is typically mediated by nervous system and occurs without conscious thoughts, like those examples that Rebecca came up with, like blinking. However, reflex may not necessarily be a good term when you talk about misophonia, but what we mean by reflex is the level of consciousness and speed that I will explain shortly. So reflexes are essential for the body's survival and protection, allowing it to respond rapidly and potentially harmful or threatening situations. Example of reflexes include pupil dilation, which could be in response to light or environmental stimuli like sounds, or even high brain functions like perception and attention. Reflexes are often controlled by a spinal cord and involve a simple neural circuit that bypasses the brain to allow a very quick response. A reaction refers to a behavior elicited by a stimulus. Unlike reflexes, reactions are not necessarily automatic or hardwired in the nervous system. Instead, they often involve more complex interplay of emotional and cognitive processes. Reactions can be physical, emotional, or cognitive in nature. As an example, physical reactions to anger, which is a negative emotion, may involve clenching fist or even pacing back and forth in response to the intense emotion. A response is an answer to a stimulus or situation encompassing any action, behavior, or set of actions that occurs as a result of a specific trigger. Like reactions, responses can be physical, emotional, or cognitive that may be more conscious and intentional compared to reactions. For example, replying when somebody or a friend texts you, or apologizing when you make a mistake, or nodding in agreement. Unlike reflexes, responses are often influenced by personal thoughts, feelings, or conscious decision makings. So reflex, reaction, and response mostly differ in two main dimensions: level of consciousness or involuntariness, and speed. Now let's delve into the details of reflexes, or in this case, physiological responses or physiological symptoms. Several studies since 2013 have explored the physiological symptoms that people with misophonia undergo, such as skin conductance response or heart rate. Consistently, they have discovered that when individuals with misophonia hear triggering sounds, they may experience abnormal activation in their sweat glands or increased heart rate. It is crucial to emphasize that all of us, whether or not we have misophonia, experience these symptoms, but in a very subtle way that often goes unnoticed. Accurate methods such as skin conductance response measure, electrocardiogram, or pupillometry are needed to detect these changes. However, it seems that these changes are more pronounced in misophonic individuals in response to specific trigger sounds. For some misophonic sufferers, this heightened activity is so intense that they describe it as feeling like their heart is tearing through their chest, or experiencing excessive sweating when exposed to the triggers. Studies indicated that after the reflexes, which in this case are physiological symptoms, individuals with misophonia undergo various negative emotions that are coupled with certain behaviors. In simpler terms, a reaction in misophonia might involve outbursts of anger, verbal aggression, or in a few cases, even physical aggression or tantrums that we might observe in children with misophonia. And all these reactions are accompanied by negative emotions like anger. These behaviors can be seen as reactions because they are partly conscious and tend to be slower, taking some time to unfold. The not so pleasant physical symptoms combined with all these negative emotions can sometimes prompt certain actions to avoid unpleasant reactions such as aggression and anger outbursts. These actions may involve covering the ears, leaving the situation with triggering sounds, or when triggering sounds are present or possible, or mimicries of certain behaviors, which are all considered responses. You might wonder why these reflexes, reactions, and responses happen, and why people without misophonia don't experience these symptoms, which is basically the core part of this talk or webinar. Brain imaging studies reveal that various parts of the brain of people with misophonia are over-connected. It is worth noting that in everyone's brain, different areas or different regions, we call them, are connected, which may count up to 130 trillion connections. So basically, our brain is like a spider web with tons of connections in it. But in the brain of people with misophonia, this connectivity is much greater. To illustrate, let's begin with this figure. This figure shows the differences in the brain functions of non-misophonics, which is on the top, and misophonics, which is at the bottom. Sorry. The light switch represents the sound trigger, which leads to activation of a certain region or network in the brain in non-misophonics. However, In misophonics, the sound trigger or light switch causes the activity of several brain regions too much, which are not necessarily needed or urgent when people are exposed to different sounds. When individuals with misophonia hear the triggering sounds, a part of a brain, which is deep inside, lights up or activates. This brain region is called anterior insular cortex, which is located at the front part of insular cortex, as you can see in the picture. This area is responsible for emotional processing. It processes our emotions. It tells other parts of the brain whether or not this emotion should be manifested or not. It is also responsible for empathy, sensory functions like pain and temperature, and salience, among other things. Salience refers to how noticeable and important something is in a given situation. If something has high salience, it stands out and grabs attention because it's considered significant or relevant. Imagine yourself walking in the streets of London, of course, and an ambulance, a very loud ambulance, passes by. The sound of the siren of ambulance is salient. That's why it grabs your attention. It's supposed to be like that. Salience is about what captures our focus or stands out to us in a particular context. All trigger sounds, like sound of chewing, are salient to the brain of people with misophonia. So these sounds tend to activate the anterior insular cortex, and due to the high connectivity that I already talked about in the brain of misophonic, the anterior insular cortex sends tons of signals to several other brain regions, such as ventromedial prefrontal cortex, posterior cingulate cortex, hippocampus, and amygdala. Forget about all these fancy terms. In this talk, I'm going to be focusing only on the role of amygdala in the context of the main topic. And amygdala is basically the hub of all our emotions, like panic, fear, and so on, and anxiety. The amygdala acts as a control center for our body's responses to emotions, particularly in situations that may be stressful or emotional. When we encounter something that our brain deems important and potentially threatening, the amygdala sends signals to other parts of the body, preparing it to respond. In the context of misophonia, triggers are perceived as threatening, leading to an increase of heart rate, sweating, and other responses as preparation for action, which is done by amygdala, as I said. And it's also crucial to note that since anterior insular cortex is overactivated and does not function normally, it does not also effectively control or mediate these physiological symptoms. As you can remember in the previous slide, I said one of the function of anterior insular cortex was sensory processing. So it does not gate, or it does not tune out, or it does not control all these emotions and all these physiological symptoms that amygdala is producing. Please be aware that the pathway I'm describing is quite complex, and I'm simplifying it for a clearer explanation. Likewise, when amygdala gets going, it creates emotions beside physiological symptoms or reflexes that are all linked to misophonia, like anger, irritation, sometimes anxiety. Once these emotions pop up, people with misophonia might act on them. For example, if they get upset of the sound of chewing, they might immediately show it by being verbally aggressive or shouting. And obviously, this is not the case for all people suffering from misophonia, but I came up with some extreme examples. As people experience the unpleasant symptoms of misophonia over time, they develop responses that we call them coping strategies or coping mechanisms. These can include actions like covering ears, avoiding situations with misophonia triggers, or as a recent study showed, and I previously mentioned, mimicry. In this study, our colleagues show that almost 45% of people suffering from misophonia exhibit this response. These responses are conscious efforts to deal with the emotional distress of misophonia or minimize it. Covering ears and escaping are pretty intuitive. Obviously, if you do not like a situation or there is an unpleasant stimulus somewhere, you would like to get away as far as possible from that specific stimulus. But you might ask, why mimicry? Our brain's motor cortex, located almost on top of our skulls and extending laterally down to our ears, as you can see in the picture. It controls our movements and sensations, including mimicry. In a recent study we discovered, which was published last year in Journal of Neuroscience, we discovered that the motor cortex is also overly connected with other parts of the brain, including those responsible for hearing and vision, as well as anterior insular cortex that I already explained. When people hear misophonic triggers processed by auditory cortex that are on the both sides of our brain, as you can see, it's color-coded green, or C triggers, which are processed by the visual cortex that is on the back of our brain. These regions send tons of signals to motor cortex that's on top of our head, and activate it. Essentially, seeing or hearing sounds stimulate the motor cortex, resulting in implicit mimicry or overt mimicry, which is excessive due to numerous signals to the motor cortex. And it's, again, because of the over-connection. A lot of connections mean a lot of signals. To overcome this overstimulation, some misophonics covertly or explicitly mimic the sound triggers like chewing. This process is very similar to when we see someone yawn. We feel the urge of yawning. Sometimes it's really out of our control, and we observe somebody yawn and we have to yawn too in order to compensate with what we see. This process, or this mental process, is called hypermirroring, a concept that was first proposed by my colleague Sukhvinder Kumar. And it's mainly because of the density of mirror neurons. And I would like to finish this talk with explaining what mirror neurons are. Mirror neurons are known to be involved in learning and social behavior. Mirror neurons are the reasons why we yawn when we see other people yawn, why we smile when we see other people smile, and why we suffer and why we feel somebody's pain when we see somebody in pain and suffering. It's extremely important for learning when we observe other people. So misophonia, as a result, misophonia is a complex disorder characterized by a wide variety of triggers and symptoms that engage multiple brain regions at network. The scientific community, through rigorous research efforts, try to comprehend the nature of this disorder, exploring potential genetic or environmental origins or the interactions between the two. While initially perceived as an affective sound processing disorder, it's increasingly recognized that misophonia may extend beyond mere sound sensitivity. Both sound and visual triggers may serve as a proxy of a more complex underlying pathology. And I would like to wrap up this talk with saying that if you or a loved one is suffering with misophonia, clinicians and healthcare professionals extend their support at Hashir International Specialist Clinic. Hashir Clinic is dedicated to providing professional assistance to individuals dealing with misophonia, grounded in a wealth of clinical observations spanning over a decade. Additionally, Hashir Clinic invites your interest in exploring their CBT or cognitive behavioral therapy course. Feel free to reach out and let them guide you towards effective solution for misophonia. Thank you.
That was fascinating. Thank you so much, Miss Adie.
Of course. So should I unshare how much time we have? We have a couple of minutes.
We've just got the 1 minute, and so we might get chopped off, but go ahead.
All right. If you have any question or anything about the talk or slides, did I unshare myself? I didn't unshare myself, but apparently.
You'll see the presentation stopped.
Okay. Yeah. Cool. So we might get some questions. I don't know if there are questions in the chat.
We have some on social media, but we'll answer them on there because I think it's just about to end the meeting.
Okay.
But yeah, thank you so much for joining us. And if you've got any questions, please send them over on email or on our social media accounts, or a comment on this video, and we'll get around to answering them.